Graves' disease is an autoimmune disease that affects the thyroid. People who have Graves' disease become thyrotoxic, either their thyroid becomes overactive. In a small proportion of patients, eyes can be affected as well. The symptoms are that of overactive thyroid. So people who develop overactive thyroid can have fast heart rate. They tend to lose weight despite a voracious appetite. They may become nervous and jittery. In women of menstruating age, they can develop irregular periods. And some people who are overactive can also develop fine shaking of the hands or fine tremor of the hands. It's an autoimmune thyroid disease. So what happens is that the immune system does not recognize thyroid as a part of the body. It sends antibodies that actually stimulate thyroxine production. So the person who has Graves' disease becomes overactive because the gland is overproducing and oversecreting thyroxine. That's a very good question. What we know from 1920s is that in about a third of patients, it can go away without treatment. However, some patients would have died in 1920s because of Graves' disease as well. These days, Graves' disease is treated and should be treated. It is one of the conditions that are potentially life-threatening, in a sense that it can cause irregular heartbeat, which can lead to strokes. It can cause, in extreme cases, it can cause thyroid storm, and it can also affect quality of life. So it is a disease that can potentially be life-threatening, and it should be treated. I do not think that one should hope that it will go away. With treated Graves' disease, it should be a normal life expectancy. Patients who, what we do know from the study, from data from 1920s, is that patients who did not have it treated, about 20 to 30% of them could have died of Graves' disease. This was a time when we did not have antibiotics and when we did not have modern conditions or modern medicine. So people were undernourished, and for example, if one was having severe Graves' disease and was to develop a chest infection, this probably was not good news. So I do not think that these days we should be talking about life expectancy. It should be normal, but on the other hand, we should also be aware that it is a potentially life-threatening illness.